So I just finished reading the new healthcare legislation, all 123 pages, and I wanted to give you some of my initial reactions on it. We start right off the bat with the so-called defunding of Planned Parenthood. Now, calling it defunding is really misleading because what it actually is doing is saying that we will not pay Planned Parenthood for non-abortive services they provide to Medicaid patients. This is a purely partisan political attack on an organization known to stand up for women's constitutional and fundamental rights to make their own healthcare decisions. This bill also attacks Medicare by removing funding sources that were part of the Affordable Care Act that helped extend the life of Medicare. Now we're reducing the life of Medicare once again, creating a crisis point for seniors in this country. It's basically a worse version of the Affordable Care Act. It's keeping the same basic premises as the Affordable Care Act, except making them all slightly worse. A worse mandate that's going to lead to people less likely to sign up for coverage and punishes people for obtaining coverage rather than for not having it, incentivizing people to wait until they're sick to purchase health care. Now, there's a lot of really good analyses out there going through this bill that have covered a lot of the major issues. So what we wanted to try and do was talk about something I haven't seen covered anywhere, which is the short-term adjustment to the tax subsidy for years 2018 and 2019. Based on the formula adjustment, as I've read it, people up to the age of 49 will see an increase in their healthcare subsidies through the exchanges, but folks 50 and above will actually see an overall decrease in their subsidies. So while the long-term plan here is to have more subsidy for people further along in age, the short term, over the next 2 years, actually removes subsidy from older Americans and provides greater subsidy to younger Americans. Now, this affects people my parents' age, my parents, my aunts, my uncles, some of whom were on the Affordable Care Act, and even with the subsidies were having a hard time being able to purchase health care. And now this bill purports to reduce those subsidies over the next 2 years, making it even harder for them to afford health insurance. Now, what kind of idea is that? The obvious vote on this bill is no.